Hi everybody, Dr. Jason Hans here from Neck and Back Pain Relief Chiropractic in Smoky Point, Washington. I want to talk to you today about injuries, and they can be injuries sustained from a car accident, from a work injury, a sports injury, or just everyday aches and pains that seem to add up over time. Here in this clinic, I practice a comprehensive musculoskeletal approach that consists of um, spinal manipulative therapy, physical rehabilitative exercises, clinical nutrition strategies to help reduce pain and inflammation naturally. So one of the biggest take-home messages for anybody that's watching this who has been in an injury or has sustained injuries in the past, it is really important to remember the acronym PRICE, P-R-I-C-E, and that stands for protecting and preventing a re-injury. So if you've been injured, don't engage in the same activities that could make it worse or re-aggravate it. The R stands for relative rest. So as it is important to be careful, it's also important not to lay in bed, because research has shown that the longer that you sit around doing nothing, the worse the injury can become, and the less likely you are able to rehabilitate it properly. The I in the acronym PRICE stands for ice and heat, when applicable. In the first 72 hours after an injury, it is imperative to use ice therapy for 20 to 30 minutes at a time while waiting 1 to 2 hours before icing sessions, or between icing sessions. And if you can do this as quickly as possible after you've injured yourself in whatever way this is, assuming you don't have to go to the hospital or the emergency room, always follow your gut instinct, call 911 or get to an emergency room if it's a life-threatening injury. But if it's a musculoskeletal injury, then we want to think about how to take care of it at home. And so icing it for 20 to 30 minutes, waiting an hour or two in between is what you do in the first 72 hours. Now after the 72-hour, 3 to 4 day window, it's okay to use a little bit of heat, but don't use that too early on. Heat is not productive immediately after an injury because it helps promote inflammation, and inflammation leads to pain. And pain is something that you're obviously trying to get out of. So remember, ice first for the first 3 to 4 days, followed by heat, which can be applied for 20 to 30 minutes every couple of hours, or you can do a combination therapy of ice, heat for 20 minutes on, 30 minutes off, 20 minutes on. And there's some leniency in that time parameter. But it's very important to stick to a 20 to 30 minute window, because if you go over that, you can be having an opposite effect of what you want. So the C stands for, in our acronym PRICE, compression. So if you have an area that you've hurt, let's say it's an ankle, you twisted your ankle, it's very important to ice it and put compression on it. So some kind of ice pack or something that can wrap around as to reduce the swelling and blood flow into that area, so that way it doesn't swell up and become even more of a painful environment. The E in our PRICE acronym stands for elevation. And so simple physics, if you elevate the area that hurts, assuming you can do that, you can help drain blood flow away from it. And as you drain blood flow away from it, you have less pain, and you allow the injured tissue to start to heal. That's pretty much our acronym for PRICE. So immediately following an injury, protect it, rest it, ice it, compress it, and elevate it. Now, beyond that, it's important that you seek care from a musculoskeletal specialist, an injury specialist like myself, in order for us to develop a treatment plan. Because one of the biggest issues with people is that they think when the pain goes away that the problem is no longer present, and that's just simply not true. The pain is generally the last thing to come and one of the first things to go in most cases. So it's even more important to identify the underlying problem and correct that underlying problem, strengthening it, stretching it, and promoting resiliency in the body So that's part of formulating a treatment plan. That's what I do here in this clinic with you, based on your specific situation. Beyond that, as a practitioner, as a doctor, it is my job to help you learn about how to rehabilitate yourself and give you the resources that you need to be able to actively participate at home in a proper rehabilitation program. And so that's what I'll seek to do with you, is to help guide you through that process, as well as apply spinal manipulative treatments and other soft tissue techniques in order to reduce the pain and inflammation naturally and effectively. Part of that process is understanding what type of nutrition, what type of pain-relieving supplements and botanical medicines that work best. I'm not a fan of over-the-counter NSAIDs. Previous videos, I've discussed them. Aspirin, ibuprofen, Advil, Tylenol. They hurt your liver, and they lead to an increased risk of heart attack and stroke. It is not what you want to be using after you've had an injury. You want to be doing as many things naturally as possible and as early as possible in order for you to have a short recovery time and get back to doing the things that you love to do. So often a question I get is, how does spinal manipulation work? What does it do? What's the premise behind it? And simply, it helps to reduce pain, it helps to reduce muscle tension, it helps to improve range of motion and flexibility. We increase circulation in the body, which promotes healing, and it activates the immune system in order to speed up recovery and get the body as healthy as possible, as naturally as possible. So when you have an issue that comes into your life, whether it's a car accident, work injury, you take a fall off your porch, whatever it is, please give my office a call, implement the strategy that we talked about, price, and seek care so we can determine what is the next step. That being said, feel free to call my clinic. The phone number is 360-925-6702, 360-925-6702, and I look forward to helping you. Thank you very much.